In the complete hemodialysis, we will see regarding a particular case scenario how a clearance will be affected based on a simple rule of 6. The rule of 6, this. Rule of 6 in AV fistula. You might have heard this, or in the previous video in the complete hemodialysis series we have discussed regarding this. There was a patient who came in casualty. He was saying the dialysis had happened recently, but despite that urea creatinine didn't come down. The patient was getting dialysis through the AV fistula. So in this particular case, going directly to the solution, what happened, what went wrong? This rule of 6 is directly having an impact on that particular patient and how it is. So what is this basically? A rule of 6 is in a patient with atriovenous fistula in whom dialysis is about to start. These simple rules will assess whether the dialysis AV fistula can be used for dialysis or not. What are those rules? First, it should at least pass 6 weeks. After the fistula creation, it should have at least passed 6 weeks. Second rule is it should have at least 6 cm of cannulating segment. All the rule come with that particular value 6. That is why it is called rule of 6. Third one is it should be 6 mm below the skin. Fourth one is the flow should be more than 600 ml per minute in the Doppler. This is what grossly rule of 6 is. In this patient, how it is related? This one. What happened and the cannulating segment is not good, or if the distance between the two needle that being cannulated for the dialysis is so nearby, the blood won't be entering the systemic circulation. It will be rotated within the axis and the machine. That is called as axis recirculation, which is more common when that cannulating segment is not there. Some students might be having doubt related to that. Let's see it in a better image here. Let us take this as a diagrammatic representation of the fistula. Okay, this is the artery connecting the vein. Here is the AV fistula. Ideally, this one is the vein is the cannulating segment. The cannulating segment. The distance between these two, at least the cannulating segment should be 6 cm. The distance at least minimum 5 to 6 cm is ideal for the better clearance. Suppose if the cannulating segment is very close by, the clearance might not be adequate. In that particular case, what happened? The cannula ideally should, here let us take this as a needle. It should take the blood from the patient to the machine. Okay, this needle have to face towards the fingers, away from the heart. From the machine, the cannula should come and it should enter the vein towards the heart. The cannulating segment should be towards the heart. So here the cannula should face this side, whereas this side it should face towards the finger, so that the clearance will be adequate. In that particular patient, what was the scenario was the direction was reversed. Let us erase this. In that particular patient, the direction was the direction of the needle, the arterial needle. Whether the technician is not aware or for some or other reason it was cannulated like this, the direction was towards this side. This is taking the blood to the machine, and the return needle from the machine to the patient, it was cannulated like this, and it was very, very close by. Two mistakes lead to the reduced clearance. One is very close cannulation can cause reduced clearance. Another one, direction of these two particular cannulas towards together. So what will happen? The blood which is taken from this side, which goes towards the machine, will start rotating here only. It won't enter the systemic circulation. Systemic circulation in the sense heart, lungs, then it goes to the various parts of the body, then the clearance occurs. That is how a CKD patient clearance can be achieved adequately. Suppose if in this particular scenario there are two, the mistake is in the cannulating segment and also very close by, leads to excess recirculation, which leads to reduced clearance. So this is very common in center where supervision or nephrology guidance or whatever the reason, if they are unaware, probably these mistakes are bound to happen. So this have to be looked for. For that you should be aware what is excess recirculation. Some students might have doubts, sir, rule of 6 is entirely different which is required for AV fistula cannulation. Theoretically, yes, that is for AV fistula cannulation, but practically that 6 centimeter gap or 6 centimeter of cannulating segment, why the 6 is? Because that much cannulating segment only can provide an adequate area for the needles to go inside to give the adequate clearance. Many times, even if the cannulation everything is fine, if the tubings are interchanged, then also clearance will be low. I hope a nephrology resident or a dialysis technologist who was saying that you got it. That is simple, yet if you focus and manage it accordingly, the clearance will be increased. It will have an impact on the patient outcome. That's all. Bye bye.